So
Thank you so much for joining another episode of Celeste the Therapist Podcast. My name is Celeste. I'm a therapist from Boston. I have a very special guest. I'm going to have him introduce himself to you all.
Hi everyone, my name is Dr. Avishek Kumar. I'm a community oncologist as part of Regional Cancer Care Associates in Edison, New Jersey, and I'm trained in geriatrics as well, and I'm also a military flight surgeon in the Air Force.
Okay. Wait, Dr. Kumar, when you say community oncologist, what does
Mhm.
that mean?
A community oncologist means the vast majority of oncologists that we have in this country are community oncologists, meaning that we don't work for a university. We're just
Mm.
out there in the community. So you have community oncologists, and then you also have academic oncologists as well.
Okay, thank you for sharing that. And when it comes to cancer, I think at this stage in 2026, either people like who are listening have experienced cancer or know someone who has dealt with cancer. What are your thoughts around and I feel like it's happening younger and younger, right? I think in the past, maybe we thought like it was more older people, but now there's younger people. What are your thoughts on why we're seeing more younger patients with cancer in 2026?
That's a really good question, and I've been talking a lot about colon cancer in younger
Mhm,
people.
mhm.
And recently in the media, unfortunately, we heard about the passing of James Vanderbeek, who was on a big TV show back in the 90s. And then also Chadwick Boseman also died of
That's
colon
right.
cancer. Yeah, at a
Yeah,
young age. And no one
yeah,
thought, I mean, he was healthy as a horse. He looked really fit in all his movies.
yeah.
But we're increasingly, just to talk about colon cancer in particular, seeing it at younger and younger ages. And so to kind of counter that, the national guidelines have recommended from the preventative task force that rather than screening at 50 years of age, we screen at 45 years of age. And the reasons for an increase in colon cancer that we see in younger people are multifactorial. We have an increase in obesity in our population. People are getting
Mm,
heavier and fatter. And on top of that, we're also seeing that patients are eating more processed foods. We're seeing quite a bit of that as well.
mm,
And then also there's a change in the gut microbiome as well. So we're not exactly sure what's causing it. There's lots of different things in the environment that may be contributory, lifestyle changes, et cetera, et cetera. People are more sedentary as well, and the diets have changed. So all of this kind of collectively has caused a increase in the rate of colon cancer in younger people.
And you mentioned the gut, right? The gut is such people call it the second brain. Can you explain to people about the importance of like gut health? Because I don't think that's talked about enough either.
Yeah, it's very important to be cognizant about gut health, about making sure that you get adequate amounts of nutrients and fiber and high quality foods, ideally whole foods in your diet rather than more processed or charred foods or foods that contain a lot of preservatives or other exogenous ingredients in order to kind of maintain the quality of the gut, maintain the gut flora and overall, a healthy diet, kind of what a farmer would eat 70 years
Mhm,
ago,
mhm,
is what most people should aspire to. Now, look,
mhm,
I love pizza, I love tacos,
mhm.
I love Cheetos, all right? And once in a while, everything's fine, but it shouldn't make up the majority of our diet. And I know it's
Yes.
convenient. There's the Taco Bell down the street, but it's, yeah, it should be an everyday thing.
Dr. Kumar, I appreciate you saying that. And I, with my audience, I like to like give moments to kind of teach and point out things. And as you're listening to this, it's not about having nothing that, these good eats that you like, but it cannot consume the majority of your diet. And if you're somebody that struggles with this, I just want to encourage you just start with something small, right? Whether it's breakfast, like if you've realized like all of your diet is a certain way, you can literally just start with one part of your day and slowly build it into your routine because let's face it, when we're trying to create change, change is very hard. Our system literally will reject it. You know, like you're fighting your system and it feels like it's hard or it's bad. It's true. It feels that way. So just start small and not put pressure on yourself to work on kind of the diet piece because we're happen to be talking about cancer. But when it comes to diet, our physical, our mental health, you know, it just really affects so much of our day to day life. When it comes to cancer, what are some signs that people tend to ignore? And I want to say this too to my audience. We are always distracted, right? We're not paying attention. I always, when I talk about mental health, I say our body gives us signs that we're not okay, but we haven't been taught how to pay attention to those signs. When it comes to cancer, and you deal with all different type of cancers, what are some telltale signs that you kind of see across the board that people may have just chalked up and not really thought about deeply?
A lot of different things. Now, people think, and people often ask, is there some sort of universal test that we can use to just pick up on a cancer or whatever else? It's usually like a constellation of symptoms. If you're
Mhm.
feeling completely healthy and then you're sick, it could be because of a million different things. It could be a transient viral illness. It could be some sort of a GI infection.
Mhm.
And if it persists, if you're feeling really weak and just tired, and let's say you're getting over a cold or something, but like 2 months later, it's still the same. And then on top of that, you're losing weight or developing
Mhm.
night sweats or fevers persistently, go and have it checked out. It's never a single kind of thing that, aha, that's cancer. Obviously, in certain
Ah.
cases, yeah, like if you feel like an obvious lump in your breast and it's
Mhm.
growing and becoming firm, then sometimes, you can be like, all right, that looks like a cancer. It shouldn't be there. But these days, I mean, most people they see a doctor from time to time, and usually, unlike the old days, you won't see breast cancer like kind of um, poking out of the breast because
Mhm.
people catch it early. But most of the
Mhm.
other cancers that are inside your body, like a gastric cancer or a lung cancer or a lymphoma, there's no one obvious sign. It's just a constellation of things being wrong, and that's why everyone should have a great relationship with their own primary care physician, such that if they do develop any symptoms like that, they should go and have it evaluated.
Do you, Dr. Kumar, in general, you know, I think that people will tell me like, "Oh, I'm afraid to go to the doctor because I'm afraid what they're going to say." And I try
Uh-huh.
to tell them, I feel like the earlier you find out things, the more treatable it is. What are your
Yeah,
thoughts about that? Because I feel like fear and avoidance play a huge role in people going to the doctor in general.
that's a very valuable and insightful point. And yeah, it's kind of like the proverbial ostrich that sticks its head into the ground when faced with a threat. I mean, if you put your head in the ground, you can't really see anything outside, and hopefully it'll just go away. But really, for healthcare, things should be taken
Mhm.
head on, right? So, back to talking about colon cancer, if you are able to detect a colon cancer early, you can surgically resect it. And some cases, you might need a little bit of chemo, you might not, and then it's gone. You're cured. You'll live another 50 years, right?
Mhm.
But if you let it progress, it's probably nothing. Oh, blood and stool, it's probably hemorrhoids. Then it could spread to your liver, to your bones, to your brain, and then afterwards, it's still treatable. And we've got like much more advanced types of chemotherapy and other types of therapies for it. But unfortunately, most of the time, it's no longer curable. But if you catch it early,
Mm.
it can be. And so
Mhm.
that holds true with anything, whether it's cancer or not. Go and have it investigated early on.
Mhm. And I'll say, so I turned 43. When I turned 40, I started getting sick. I had my liver, there was like predisposition autoimmune hepatitis. Basically, my liver was turning on itself and
Uh-huh.
I couldn't poop. And so they did all these tests. They did a colonoscopy, but they did say by 45 they wanted me to have one. But there was all these symptoms, and come to find out, like my vitamin D was extremely low. And
Uh,
I think it just kind of jacked up my system because once I started taking the vitamin D, it was better. So sometimes it's something and sometimes it's nothing. But I think that not finding out, it's like you're suffering in silence, you know?
yeah, you are.
Um, when it comes to symptoms being ignored, curious because I ended up going to Quest to getting labs done. I was seeing doctors for 2 years. My eyes was messed up. Like I had inflammation in my eyes, and I got deeper to the root of what was going on through my investigatory uh, skills. What would you say to people who may have symptoms and they don't feel like the doctor is hearing them? The reality is, like doctors are overworked, overwhelmed, and sometimes, I mean, doctors are human. What would you say to a patient that may have certain symptoms that they don't feel like is being treated um, uh, well?
Um, you're absolutely right. Doctors are exceedingly overbooked, double booked, triple booked. They're behind. There's a lots of administrative burden. But in the end, your doctors work for you. And if you have a concern, especially if it's a pressing concern, even if you're a young person, even if it probably is nothing, that's your life. And it's one of those things where even a easily correctable thing like a low thyroid, having hypothyroidism, or just having elevated blood pressure that gives you headaches. A lot of these things can be fixed with a handful of pills. So just advocate for yourself and bring it up to your doctor, and make sure you have a good doctor that you know and trust who has your best interest in mind. The worst is just kind of, I mean, not trying to knock um, kind of urgent cares, but they have their place. But you shouldn't get your primary care done at an urgent care. You should have it with like a doctor that's your relationship with them is longitudinal. You've seen them before. They know you. They know the name of your dog. They know what you do for work. And then, therefore, it's kind of a mutual trust, and you can present them with something, and it shouldn't be blown off. It's really your right. And if it's something that's bothering you, you should really investigate and chase it down until you find out exactly what's wrong. And yeah, just like in your case, I'm happy you're feeling much better now. And there's probably millions of people across the country or around the world who have problems that are easily correctable, right, with the right diagnosis.
Yeah, and then what Dr. Kumar is saying, I just want to highlight PCPs are important. I've always had a PCP, so I didn't know that people used. I when I worked in the ER in the psych, the doctors would get frustrated because a lot of times people were using the ER for like a PCP. Establishing care is like so important because that doctor can follow you, make the referrals and things like that. And sometimes these are things that people weren't taught how to do, taught how to pay attention to signs and taught how to advocate for themselves. So I'm hoping as you're listening to Dr. Kumar share this stuff, it can empower you to like work on giving yourself what you need. Um, when it comes to colon cancer, and people are being diagnosed earlier and earlier, do you feel that there's more knowledge around it where people are um, getting that diagnosis? Because I know someone personally, maybe like 5 years ago, so he was probably like 30 who dealt with colon cancer and
Mm.
it was detected early and it was fine. But I remember thinking like, how did he get colon cancer? Because I just honestly, like, I thought it was something that older people got. Are you noticing more education around that?
Absolutely. And sometimes certain tragedies that we hear about in the media with celebrities, that helps raise awareness. And plus, what we're doing here, this dialogue and getting these broadcasts to your followers, that increases awareness. And in general, I think the knowledge is kind of permeating. And as people become more aware of it, that even if they're young, it doesn't make you Superman. You probably don't have cancer, but if you have any alarm symptoms like sudden weight loss, blood in your stool, or anything else, not just colon cancer, anything in general, it's well worth your time to have it checked out and evaluated. I mean, for the longest time, I never had a primary care doctor. I figured, well, hey, I'm a medical student or a college student. I read about this stuff. I feel healthy. But everybody from the age of 18, they should transition over from their pediatrician to a primary care doctor and become friends with a guy or lady and see them like once a year, even if you're completely healthy. Just check in.
Yes, that's good. And I wanna move over to like the emotional side. So, as a therapist, I've walked with people through talking about cancer, whether it's them or a loved one. And for people listening that may have family members or friends that are dealing with cancer, what are some supports or things that would be helpful for the family or friend to provide for that person that's struggling right now with cancer?
So yeah, sometimes it's important to provide support, not in the dramatic moments, not at the moment where the diagnosis is
Yes,
done, not like at the moment they're sitting there getting their IV chemotherapy, but in between. You might get chemotherapy once every 3 weeks, but in between, if you're a good friend or a family member, go and visit and talk to them. And it doesn't have to be
yes,
talking about the cancer, but just remind them they're
yes,
not forgotten, that you care, that you notice. I mean, the saddest thing in the world that I see sometimes, I got these patients that come in and like, yeah, I've got a son, I don't really see him, and they could live down the street, right?
yeah,
So
yeah,
everyone's busy, everyone's got like busy jobs and stress and kids and all sorts of other personal endeavors. But even if you can just call that person, if you can share it
yeah,
and make that personal connection, it can do wonders. And yeah, and also I strongly encourage patients, even if they're holding it together, even if they're not severely depressed or anxious, undergoing cognitive behavioral therapy, just having somebody that they talk to on a regular basis who can provide a objective opinion, be professionally trained, and listen to them can be really, really helpful. So you shouldn't wait until everything falls apart. Then it's like, all right, I need to start Prozac and see a psychiatrist. No, it
yeah.
needs to be preempted.
Yeah, I love that. I love your advice because I think the work that I do, I'm so used to leaning into helping people with the vulnerability, leaning into trauma and a lot of pain. But I recognize as I'm talking to people that they don't know what to say. It's not that they don't care, right?
Uh-huh.
It's not that it's like they hear this diagnosis and they're just freaked out by it. And so it sounds like what Dr. Kumar is saying is that you can go and like, hey, how are you? Checking in. We don't have to talk
Yeah.
about cancer. We can talk about
No.
anything else. But um, I'm assuming like sometimes they end up feeling alone. Like cancer patients feel alone when, or and for people that are struggling with cancer, be okay with asking for support. I think sometimes, you would know better than me. I don't work with a lot of cancer patients, but I'm assuming sometimes they don't want to feel like a burden. And there's probably people out there that wants to support but don't know how to support. So we have these two things happening, and they're not communicating with each other.
Yeah, it's shocking how often I hear that. I must hear that every day. No, I
Oh,
don't
you
want to be a
do?
burden on my
Yeah.
family. I don't want to be a burden on my wife. Well, you probably took care of your kids when they're really young, and yeah, you probably helped support your wife or your husband at the time when they're sick. And that's the way society works. From the time of cavemen, we have families for a reason. And like, fine, it may inconvenience people, but you work as kind of like a village. You take care of
Yes.
the person, you keep them
Yeah.
comfortable, and not just cancer-related stuff. I mean, geez, like watch a TV show with them, talk to them about
Yes.
the game, like do
Yeah.
something, just keep them engaged, so
Yeah.
their mind doesn't just keep coming back to it, and it's not like kind of
Yeah.
just brewing in their mind with nothing
Yeah.
else to talk about.
I listened to this podcast called 10% Happier with Dan Harris,
Ah,
and,
yeah,
he
great
was
book.
talking. Yeah, yeah. Oh, yeah,
Yeah,
yeah, yeah, and, this lady was on, and she was talking about how, like, she had this prognosis, it wasn't great, sounds like it was cancer. She's like, "I met with the oncologist," and, she said, "But that's not the only thing that's happening in my life." She said, "There's also X, Y, and Z." She started talking about the good things, and she said, I am very mindful and cognizant of not allowing this one area, and I'm speaking to people that may have a hard diagnosis right now. Um, I'm really cognizant about not allowing this one part of my life to take over, and because it can take over. And like Dr. Kumar is saying, like if you can get connected with a therapist, even a support group, right? We have the phone at our fingertips. We can look up. Are there support groups around there? And I'm sure the cancer centers are familiar with a lot of them because they have these resources. And being connected with other people is the best thing you can do because trying to do this alone, your mind will wander and it can take you into dark places. And I remember listening to the lady talk about that, and I was like, wow, that is so powerful to like be hit with like this hard diagnosis. But it goes to show you how powerful our mind is, you know?
oh yeah, yeah. People can dig their own rabbit holes and just kind of
Yes.
fall into these recursive mental thought traps, and you really
Yes.
just need the perspective of other people. And
Yeah.
this even happens in the totally treatable and curable cancers. Like people are like, well, my
Yeah.
life's over. It's like,
Yeah.
no, you have breast cancer and it's localized. And you're gonna need a couple cycles of chemotherapy, but more than likely, this is gonna be gone, and you can go back to
Yeah.
living a wonderful life. So, to kind of reframe things and bring it back in a manner that individuals can't really think up on their own. If you have people interceding and helping them and kind of bringing the positivity back to their lives, it can really pay off in spades.
Mhm, mhm. I remember when I was getting ready to go to a nail appointment and I felt like a bump like on my breast
Uh-huh.
and the first thing I said to myself was like, "Oh no, you got cancer." And then I started thinking about my kid. Like my mind started spiraling and I went to get my nails done and I was telling the lady and she happened to be a radiologist or something at the hospital at night. And she said, "Oh no, if there's pain there," like she explained to me like that wasn't one of the symptoms of it.
Huh.
It happened to be a lymph node. But I think about that moment and I think about how quickly my mind jumped into this like dark space without
Oh yeah.
no real nothing. And so I know when it really is happening, I know that your mind is jumping. And so do yourself like give yourself that medicine of community, give yourself that medicine of working on reframing your mind so that you don't because I do think that the energy that we can make us fight a little longer. I don't know. What are your thoughts about that?
I completely agree. Positive vibes and positive
Yeah,
emotions, even though there may not be any, I mean, there's probably some scientific basis to it that the
right.
fact that if you're depressed, the outcomes may not be as good. But just in general, who wants to feel crappy or who wants to feel like, oh, well, my life is basically over? And having friends and having a good support network, it
Yes.
does wonders. It's not just like a lot of times emphasize, okay, medicines and chemotherapies and immunotherapies for cancer.
Yeah.
That's one part of it, but being happy and being engaged and trying to live as normal of a life as possible. We
Yeah.
encourage all of our patients to do that. As a matter of fact, in the middle of chemo, where if at all possible, if there's a family trip or a wedding, we'll say, okay, let's pause it for a week, go do that important family thing, and come back, and we'll
Wow.
restart it. I think that's far better than nope, you are stuck in this plan, and no matter what, we will
Yeah.
not deviate. We're human beings, and living
Wow.
life is important.
I love the care. I've never talked to a doctor that's dealt with that's an oncologist, but I love like listening to you talk. I love how you're integrating care. It's not just the literal medicine that you're giving them to help like kill this stuff, but it's also the other stuff that you're trying
Oh
to
yeah,
remind them of.
equally important, preserving quality of life.
Yeah. Okay. What's one thing you want listeners to remember as we begin to wind down? We've talked about being mindful of, what's happening with you, the symptoms, and what is one thing you want listeners to kind of take away from you today?
The thing I often say in interviews like this is the best cancer story is the one that we prevent. Right?
Oh,
So,
yeah.
yeah, if you can catch something early, then it's far more likely that we can treat it or get rid of it, cure it, put it into remission, take your pick, right? Whereas everyone's busy, everyone's stressed, like, oh, I don't have time to go get evaluated, I have this weird symptoms, you know what, it's probably nothing, it'll go away. That is the rabbit hole that you don't want to go down because ultimately, God forbid it is something serious. Well, you've given that serious thing months to, in some cases, years to develop, right? And then it may be
Yes.
much more difficult to treat later on.
Yeah, no, that's good. I appreciate you saying that. I'll be working with someone and they'll be talking about these symptoms, and I'll say they're like, "Yeah, like I just gotta do this. I'm gonna go here, then I'm gonna go to the ER." And I was like, "Why? Why can't we skip? It's not even nothing that's important."
Yeah, the heart
And
attack
it's
can
like
wait.
yeah, it's like, and I think that when it comes to somebody else, that person will be like, no, go to the doctor. We could be our biggest critics. We don't realize how much we don't honor what we need. And so I really want you to honor what you need. This is a quick rapid fire. What comes to mind? I'll give you 4 different words, and then you just tell me what comes to mind when you hear this word. Fatigue,
Get some sleep.
blood and stool,
Go see a doctor.
Yes. Changes in bowel habits
If it persists, go see a doctor.
and unexplained weight loss.
If it persists and you're not on some sort of a diet, go see a doctor.
Yes. Okay. Dr. Kumar, this was great. How can people tell people about where you're located and how people can reach you?
Sure, I'm in Edison, New Jersey, which is a kind of a suburb of New York City, and I guess my social media handle is Avi Kumar MD, and that's on Instagram and Facebook and TikTok and YouTube
Okay.
Shorts.
Okay. And are you educating the people on social media?
I try to, yeah, I'm trying to
Okay,
get
good,
the
good.
word across. A lot of this stuff is preventable, and
Yeah.
yeah, yeah, much rather not treat somebody if I can.
You're so you have I mean, and also, I mean, we didn't talk about this, but you were in the military, right? Like
Yeah, yeah.
you're so down to earth, like you're so relatable and easy to talk to.
Oh, thank you, thank you. You too.
But quickly tell people about your military experience because I thought that was so cool.
Yeah, so I'm a flight surgeon in the Air Force Reserve, and it's the greatest job you could possibly imagine. We take care of pilots. In some cases, we take care of astronauts as well. We
Wow.
basically we dress up like Tom Cruise, and we go on missions on fighter jets, break the sound barrier, fly upside down, pull G's, and it's a blast. And in doing so, we help advance the science so that people can be
Oh.
safer on airplanes and also in space in the future.
Oh, nice. You look, Dr. Kumar, you look 25 years old. I don't know where did you find time to do all this. But thank you so much for being here and for
My
sharing
pleasure.
your wisdom with my audience. I appreciate you.
Thank you so much, Les.